Hi, everybody. My name is Evita Maureen, and I am the CEO of Rise Recovery, and I am here to introduce you to our show, Rising Together. Today's first episode will be about recovery and resilience, and the reason that topic is important is because of everything that we are going through with the crisis, with the economic and health challenges, and there's a quote that I've heard well before this all started. It says, be kind, for we're all fighting a great battle. And I think that is good advice in normal times. But when you add the fact that so many people are experiencing very real struggles right now in large ways, I think this is an important conversation to be happening. So I'd like to note that we will be streaming on our platforms. So please ask questions, comment, share your thoughts. And then let me introduce you to our wonderful guest today. We have with us today Tali Dolge, the CEO of Family Jewish Service. Nice to see you.
Hi, how are you? Thank you so much
great.
for having us here today. Thanks, Evita, for everything.
Thanks, Tali. Also, Mary Gar, the CEO of Family Service.
Evita, thank you also for having us as well.
So glad you're both here today. And then finally, Jessica Knutson, the CEO of Clarity Child Guidance Center. Welcome.
Hello. Thanks so much. A pleasure to be here.
Thank you all so much for spending your time on this important topic. These leaders are, among doing so many other things, are with Rise, some of the key service providers that are leading the way for youth mental wellness at South San ISD. Last year, South San opened the Care Zone, which is a safe place for students and their families to receive help with basic needs, and also resources provided by 6 leading nonprofit agencies to support students, families, and teachers in their mental wellness. So let's kick it off with our discussion. We have, for all guests, I'd love to know, what are each of your agencies doing to maintain your services during this time? Tali, could you get us started with that question?
Sure. As most of us are doing right now, and I'm so proud that we were able to really pivot very quickly and put all of our mental health, social services, and senior service counseling on telehealth. So we have actually gone fully virtual during this period of time. And I will tell you that because we've gone virtual in this period of time, we have seen an influx of people wanting the services, people who did not have the transportation resources or accessibility. Now they can either use the phone or they can use a video call and be able to see their therapist. And while we had seen a show rate of clients at about 65%, we're now at 92% of clients seeing us and coming in and seeing our clients. We also seen an influx of people who are wanting these services, and we're seeing a waiting list, which shows that people are taking their mental health just as seriously right now as their physical health. So I'm thrilled about that.
Thank you, Tali. Mary?
I'd like to preface my comments first by saying that the populations that each of us is serving, they had challenges before this pandemic. Mm-hmm. And what this is actually doing is shining a light for the broader population on the challenges that have existed all along. Mm-hmm. And it's unfortunate that it's taken this, but what we have to hope is that when most everybody finds their quote unquote new normal, when these challenges are hopefully going to be resolved, for many of the populations we served, we don't want them to go back to their normal because they didn't have a good normal to begin with. Mm-hmm. We want to make sure that we continue working to assist them and help them improve their lives and get on a better, stronger path. So with that, knowing the types of work that we do across our various services and programs, we did not close at all during this time. And we were able to move some of our programs and services onto online platforms, such as our online schooling that we adjusted when we had to close our classrooms. And we were also able to move some of our financial counseling virtually and establish telehealth for our mental health or behavioral health clients. But we also had a whole population that wasn't feasible. So we continued to do telephone checks, also going out. We do a lot of face-to-face service still. About 1/3 of our program is still face-to-face, either in our clients' homes, or they're coming out to one of our sites or to other settings, or over at our community center. So we've continued to work with our clients to meet the needs where they're at, whether it's virtually, telephone, or face-to-face. And as our community starts to reopen, we will continue to work with them where they want to have their needs met.
Thank you. So I'm hearing an influx in care, Jewish Family Service, an acknowledgement of some critical issues that have been uncovered through this crisis at Family Service. Jessica, what are you seeing at Clarity?
So Clarity, much like Family Services, has stayed open throughout this situation. We provide inpatient psychiatric hospitalization to kids and teenagers, and that need has continued. So those doors have remained open, and we still are able to do 24/7 crisis evaluations for families in crisis. I think what we're seeing in that perspective is there is a real struggle from families. How do you mitigate the risk of exposure in a congregate care setting, which there is some, because we have locked units and with staff and kids within close quarters to each other, with keeping them safe. So we've had to get creative also in some of our solutions. So maybe the parents are just too anxious to leave them on an inpatient unit, but how do we make sure that their depression and anxiety are maintained? We have maintained our partial hospitalization program. We've limited the number of patients in that, so we can do some social distancing and some of the other things to decrease risk of exposure. But we're still running about 20 kids in that as well, so the need is out there. And much like Mary and Tally discussed, our outpatient services have gone completely telehealth. Although we do have a plan over the next 2 weeks to start some inpatient services with, again, some social distancing and some infection control procedures in place to meet the needs, because we're similar to Tally. We're seeing an increased show rate for those telehealth services, but there is a small segment of the population, as Mary referred to, that it's just not a good fit. Either they don't have the technology available to them, or we see some 5-year-olds that's just has not proven to be a good fit, and so we want to open that door back for those folks that have not been able to be served through telehealth services.
Yes, a lot of challenges. The telehealth component has been an innovation for many, but it's only for a certain developmental stage that is. And then for the very young, that is definitely a challenge. So it sounds like a lot of problem solving going on in your agency, and I'm sure across all three. So I'd love to ask you, this is, this idea of recovery and resilience is important because this crisis is so unusual. Tally, everyone is experiencing these major sacrifices in different ways. One neighbor might be struggling with anxiety and grief and loss and hardship, and another may consider quarantining a blessing. And all of these different emotions are coming through, and people are experiencing this crisis differently. And then there are those people that are in between, the person who's trying to juggle taking care of a kid and a full-time job and a full house, and it is just weary and overwhelming, and where they fit in their ability to acknowledge what they're experiencing. So as someone's put it, we are all in the same storm, but in very different boats. Whatever that boat, what are some things that we should understand or can offer to ourselves or others that can get us through tough times?
So thank you. And I actually spend a lot of time right now, and one of the pieces that JFS has done is some outreach and education on anxiety during this pandemic. So I speak to a lot of different organizations. I've spoken actually today with a large group of women talking about anxiety and really sharing some sort of best practices and how we're all coping during this period of time. Like you said, none of us have a roadmap for this period of time. None of us have any real clue about what we're doing. So we are going about it in the best way we know how. So one of the best things that I think I've heard from people these days is it's okay not to be okay. And it's okay not to have the answers. As somebody who likes to have control and suffers from anxiety personally, this is a very challenging time. But one thing that I do know is that I'm able to compartmentalize right now, and I think that this period of time has given this to me over the last 2 months, is what I can control and what I can't control. And so what I really do is actually have 2 lists. And I go over those lists in my head, and I actually change what I can and can't control every day. I realized the other day that I was becoming extremely anxious with the thought of all these people going out without face masks and not social distancing. And I realized I was ruminating and really considering and thinking about that. And I actually called my clinical director, and I was like, what is this? And what she's like, what can you control about this? And I was like, as soon as she said that, my whole body language changed. My shoulders went down. And I was like, you're right. I can't control this. All I can do is know what I can do to either support the health of others or to support my own health and my family's own health. So I think that is one of the biggest and greatest lessons is, first of all, it's okay to not be okay. And the control, what can I control and what I can't control during this period of time. And that none of us have the answers. None of us have been put through a pandemic before.
Right. I really appreciate you mentioning probably one of the more common anxieties that people are experiencing as they go out into community is how everyone else is taking care of making sure that this isn't spread. And so the mask wearing is definitely a trigger I have heard across the board. And so your solution is maybe suggesting that we make lists of what we can and can't control, literally writing down what's in our head to get it out and to evaluate. That's great. And so
and know what you can and can't control. I mean, really, that's the major piece in the takeaway.
Yeah, the evaluating what you can and what you cannot control. Thank you for that tip. I would love to hear, and I think our community would love to hear more about what this mobile mental wellness initiative that you are a key stakeholder in at South San. Can you tell us what's happening there now to support mental wellness of students, families, and administration during this time?
Absolutely. First of all, I'm so proud of the fact that we are all working together and that these 6 agencies continued to do these services and understand that we had to give these services to whoever needed it right now in our South San community. And we didn't skip a beat. So I will tell you that we continue to do virtual online counseling. And we also have telephone counseling for anyone who's in need of individual services. And we didn't disrupt those services. So everyone who had been receiving counseling at the time that the COVID-19 had come about are still receiving. So we have over 100 people right now receiving counseling still for the care zone. I will also say that we really looked at the needs of the community. We understand that people are not getting online anymore. They're not getting the education. They're not tuning in. It's an extremely hard time. But the care zone has a hotline that goes directly to our program director Monday through Friday between 8 a.m. and 6 p.m. that they can call and just have a consultation. So or ask a question. And she is a mental health licensed mental health counselor, and a lot of these parents are calling in saying, I just don't know what to do with my kids. So we have had a lot of wonderful response to this, to the phone line, but also to the counseling. And we are also continuing to provide online resources, training, and a lot of support for the teachers and the administrators during this period of time. We are working on a program for the counselors at South San, for all of the counselors, so that they're all able to be equipped with dealing with the mental health challenges that are going to arise after this period of time. So I will say, and it's wonderful that I get to bring this up on this call, but I was able to go through the numbers of people that we have seen during this year since November when we opened the care zone. We have seen over 1,300 students, teachers, administrators, and parents during this partial year, and we continue to do that. I will say that this, in terms of the best practices of the virtual piece, is that we won't have to stop the care during the summertime. We are going to continue to offer this and continue to provide them the support, especially during a period of time like this. So
That's great.
I'm thrilled. Yeah.
Thank you for sharing that. And I love hearing that an ISD is preparing their administration now during these closed months, using the nonprofit partners in their community for a mental health support so that they can brace themselves for a group of students who have experienced a major trauma in their lives. And that's what you said about tuning. They're not tuning in anymore. They're tuning out. And that's a really important segue to a question that I want to ask to Jessica, if you don't mind. Young people are missing some major moments during this time. They're missing time with friends, graduations, prom, their teachers, and now their parents are asked to play a lot of competing roles, parent, teacher, social distancing police, and they may be struggling themselves. And so their capacity to do any of those things well is in question. So what wisdom do you have for parents who are struggling with this?
Well, that's a great question, Evita, and I think that speaks to what some of us in the mental health community and even the larger community are referring to as the second wave of the pandemic, which is going to be the mental health wave. If you really look at the development of an adolescent, especially, their peer group is their main source of socialization. They would choose to spend time with their peer group over their family any day of the week, which is developmentally appropriate.
Right.
And we have basically cut that off at this point. That is going to result in a huge upswing. I think it could be a PTSD, it could be depression, anxiety, but I think 2, 3, 4 months from now, we're going to be having a huge influx of these type of cases. So I think it's important for parents to notice any change in their child's behavior. I mean, sometimes we categorize depression as looking one way or anxiety as looking one way. It looks very different in everybody. So the big thing is a change. So if you had a child that was withdrawn and they swing the other way, that's a warning sign. So I think just being very mindful for any change in any direction of your child's behavior is worth paying attention to, and getting them to services now before it becomes a crisis, I think is going to be really key. On the parent side, that is rough. It's there's not enough hours in the day to do all the tasks that folks are being asked to do right now.
Right.
And I think, to kind of speak off some of the things that Tally mentioned, giving yourself some permission that you don't have to do it all perfectly. If you don't get that list done from school, it's okay. It's okay to turn the computer off and go for a walk with your child and just have some fun. We're putting a lot of pressure on ourselves, and I think we need to back off from that sometimes. And as much schedule and predictability as we can also do into that. Our parents taking some time for themselves still, for self-care. It's that old adage we all know: if you're in the airplane and you've got a child seated with you, you put your air mask on first, and then you take care of the child. We can't lose sight of this and this bigger thing as well. We have to make sure as parents we're taking care of ourselves as well, and being mindful of those changes in our own behavior too, because I think the parents are at risk. I can't imagine if my child was graduating this year, the impact that would have on me as a parent also. So I think we just need to be mindful of it, talk about it, acknowledge it, and if we're starting to suffer some impacts, get into treatment.
Right. I love what you're saying. It's about giving ourselves permission to experience that loss and feel that loss. I think because so much of our time is gravitated toward social media, there's this platform that allows us to judge whether or not we have validity in our feelings around missing prom or missing these milestones, but to not let that bother us, to give ourselves some grace, to tune that out, and to access mental health support for true grief and loss around some of these issues. I think that's fair. Thank you. Mary, I wanted to talk to you about the social determinants of health, because that is another factor that plays a part in this crisis, and you are a leader in understanding social determinants of health. Can you tell me a little bit and tell our viewers what that means for caretakers from a caretaker perspective, and how these determinants can help families better prioritize, as Jessica was saying, what is most important right now.
Thank you, Evita. I'd like to start off by giving some context. So, in the United States, we tend to look at our healthcare system, our doctors, our nurses, hospitals, clinics, as the entities that will, quote unquote, fix our health. If we're sick, if we don't feel well, if we have an issue, we want to go see them. They give us a pill, they give us a prescription, a surgery, whatever it is, they fix our health. But in reality, the average person in the United States only sees a healthcare provider about 100 minutes a year. If you're only seeing a healthcare provider 100 minutes a year, they do not influence health on a large-scale basis.
Wow.
Where people are most influenced in their personal health is where they spend the majority of their time, which is at home, work, school, after school, all the spaces that we work in. So when you're looking at who are bigger influencers of health, it's an employer, it's a teacher, it's a parent, it's a caregiver. The next big influencers of health, bigger than the hospitals, are also those places where people go and have the opportunities to tap into healthy or unhealthy influences. Do they have access to affordable, healthy food in grocery stores? Do they have a safe neighborhood to walk around in and socialize and exercise in and go out with family? Are parks nearby? Do they have libraries or museums that can provide cultural enrichment and learning, or community centers? All of those kinds of entities, churches, bigger influencers of health, because that's where people spend their time and have an opportunity to learn unhealthy or healthy habits. So from there, when you're talking about the social determinants of health, those are the conditions or factors in people's lives based on where they are born, raised, live, work, play, and age that create either opportunities or barriers for them to be happy, healthy, and successful. So examples of them, and I'm going to reference the Centers for Disease Control Healthy People 2020 model.
Sure.
They reference 5 pillars in that area. First one is economic stability. Do people have financial means, workforce development that's prepared them for a career where they can earn money to sustain themselves and their family? Do they have food security or not? Do they have home security? The second one is education, and that starts with early childhood education, making sure kids are kindergarten ready, reading at 3rd grade level, graduating from high school, either college, ready to go to college, or going to job skills training. The third one is health and healthcare, access to primary care, access to health care to help their needs, and health literacy, understanding what it means to be healthy. The fourth one is social and community engagement. Do they know how to access community resources to help themselves and their families? Do they know how to be contributing and active members in their own communities? Do they feel discriminated against? Do they feel that they are included in activities or in their communities? And then the fifth one is having a strong neighborhood and built environment. What is the quality of their housing? Do they have safe neighborhoods? Are there environmental concerns out there? Are there stray dogs that prevent them from being able to go outside? Or, drive-by gang activity, or, drug houses in the neighborhood, which is all what we see in some of the areas that we serve. So those are the 5 social determinants of health. One is not more important than the other. They all interrelate. So when you're working to address an issue in a person's life, if you're only scratching at the surface or addressing a symptom, then you're not necessarily making that consistent, long-term, sustainable change in that individual's life. How can you work collectively to address, if it's an educational issue that ties then to access to employment and economic stability, and enable them to live in a safe neighborhood, to be able to understand how to be engaged in a community, to be able to, have a healthy, outcome in life. All of those intertwine. And then with that, when you're trying to move forward, to be happy, healthy, and successful, so to speak, you've got to understand, how do you do that sustainable change? If you're only addressing an individual, but the whole family is affected, you've got to address that family dynamic. So now you're talking about intergenerational and multi-generational change if you're going to break those cycles of intergenerational poverty or domestic violence, economic instability, et cetera. The list goes on.
Right,
so for
right.
caretakers, how do you work in each of those spaces, identify what your concerns are, what your needs are? And as I said at the beginning, for a lot of people, these were challenges before this pandemic. How do we keep working with families today so they don't fall further behind, and then ensure that when things do start to settle down, that we're prepared to move them ahead? We already hear families saying that it's too hard for them to figure out how to keep their kids in school these last couple of months. And so these kids are now not just missing a couple of months, they're behind a whole semester. Some families are saying that they're really just going to have their kids repeat all of next year. That's another type of trauma on top of everything else. And part of it's tied to technology, but part of it's tied to just the sense of being overwhelmed and stressed with trying to balance either work, that work-life balance,
Right.
or losing jobs and just struggling to be able to feed the family for the day and worry about that rent piling up. They might not get evicted today, but in 60 days, they're still going to owe 3 months rent. How do they work to address all of those now so they can be best prepared and supported so they can keep moving forward to become a stronger, stable, healthier family and a stronger, stable, healthier community?
Right. Thank you. Thank you for that. And, I think what you said about this being an issue prior, these social determinants, and then COVID, talk about spinning on people's heads the immediate economic instability, the immediate neighborhood challenge when you can't engage in community the way you used to. All of these things come to a screeching halt for so many people. And in crisis, we most need to be our best selves. And because we are being asked to shelter in place, instead, many of us are taking to coping skills that may or may not be the healthiest options. Being at Rise Recovery, we serve youth, young adults, and families overcoming drugs and alcohol. And so we are seeing an increase in alcohol consumption. One of these most recent months, I think March, was one of the highest ranking months for the liquor industry, and we're seeing just what used to be for normal drinkers. We won't call them necessarily substance misusing or addicted. A glass of wine after work is becoming 5 glasses of wine, and what that's doing to their ability to make healthy decisions under the influence, and whether it's causing negative consequences is a real question and so I would challenge all of us to think about and help our community who's online right now listening. What is one thing you advise against doing when feeling stressed or overwhelmed, and what is one thing you advise trying instead? Would anyone like to answer that?
I think one of the best things right now is and one of the hardest things, especially when you're dealing with anxiety during a period of time and you're not used to dealing with anxiety, it's this self-blame that we do. And I think that needs to be taken out of this equation. If you are feeling anxious at this time, or you are feeling like you're not doing, and I say in quotes, doing the right thing, because there's no right thing to do, this self-blame and beating yourself up over certain things really is so much more of a hindrance than it is a help. And it will keep you in that sort of negative spiral of thoughts and thinking. So then the alternative to that is really thinking about the things that you are capable of doing, what you do have, the gratitude. I think gratitude during this period of time, even if you have nothing and you're able to find 2 or 3 things in a day that you're grateful for, whether it's the sun shining in a day or the fact that you just woke up and were able to get out of bed, being grateful and gratitude produces these positive hormones and these wonderful things in your brain. And I would say, so stop with the negative self-talk. I'm not good enough. I'm anxious. I'm this, I'm that. Take that out and really look at least 3 very positive things about either who you are, the life you're leading, or even if you can't find anything, something outside of your grasp that you can be grateful for.
Awesome. Thank you. Anyone else?
And we've talked a lot here at Clarity because we've got nursing staff and doctors and mental health counselors that still have to show up every day and work in a congregate setting. And so, we meet a couple times a week as a leadership team. And one of the things we talk about is giving permission to feel what you feel. There's no right way to respond to this, and we're all going to cycle through it differently. And so we all have to have permission to have that lousy day, or that day we have to leave early, or that nurse that's going to be in tears. That's okay. And we let them have that space and that time to respond how they're going to respond, because this is a marathon, and we can't expect everyone's going to show up and have a great day every day. And so I think it's just giving that collective permission to go through it and cycle through how we're all inevitably going to cycle through it. And the other thing we really talk about a lot is, I think one of the hardest things about this is we've lost that ability to look forward to things. We all have that vacation in June that kind of, keeps us going during that tough day, or that family reunion, or going to to that special restaurant on Friday night. And so we've really challenged ourselves to rethink what that looks like. And so it's, it just looks a little different. It's planning that Zoom call on Friday night, maybe instead of that restaurant. It's planning that good takeout, but putting that back into your life, that you have those events, those things on your schedule that bring you joy, that you can look forward to, because we need that. We need that future planning to help us through these tough times.
All right. Thank you.
Avita, I'll chime in now. So first off, I know we're on a social media platform right now, but one of the things that we really need to ensure folks are considering is they don't need to spend all their waking hours on social media, and especially seeking out the negative social media. Inspiring social media is fine, but not all the time, and that's what we're seeing a lot of folks doing right now. Another thing is don't beat yourself up, and especially don't take it out on your family, or if you are going to work, don't take it out on your colleagues. It's how to not push that negativity inward or outward. On the positive side, just a couple of things. One, show respect, listen, communicate, some basic things that we don't always do, but we know we should be. And on the other piece too is, we're talking about, taking care of each other, taking care of ourselves. We talk about work-life balance, but a couple of years ago, I learned the phrase, it's really more like work-life integration in today's world. And that definitely is what's happening now with this pandemic, when families are really now cramped together, whatever size home they might have, spending a lot of time together that they hadn't expected to, and they may be wearing on each other's nerves. And now having to adjust to new household routines or creating routines. So how can they do so in a way that still allows some personal time, develop quality family time for themselves, maybe have a date night, have a family game night, but also looking at that, carve out personal space and time for yourself. Also looking at, some of the basics, getting adequate sleep, adequate activity, adequate nutrition. That starts to talk to that, how do you help keep your mind, body, spirit healthy and moving forward? As Jessica said, we have to find things to look forward to. Maybe it's a date night in the garage or in the backyard with a good takeout. Maybe it's playing a puzzle, or something else, or communicating online with grandmother, who lives in another state. But finding conscious, deliberate activities to help look forward to in a positive way instead of a negative way.
Oh,
and
thank
Avita,
you. Yeah.
I have just one extra thing to add, and I think one of the things, and it's just an extension onto what Mary said about social media. I also want to talk about the news in the news cycle. Our bodies are not made to have a 24-hour news cycle. Our minds are not. And so I'll tell you, at the beginning of this pandemic, in order for me to gain control, which I talked about at the beginning, I had to watch the news 24/7, because I thought if I missed something, then, there would be a problem. I started to realize that I was getting all of these physical symptoms from my anxiety, from headaches to actually thinking that I was coming down with something and what this looks like. And it wasn't just me. This was actually people around me who thought that they had, because we know the symptoms of the COVID-19, that people were like, I'm getting a scratchy throat, or whatever that looks like. And they started to really feel those symptoms. And so I suggest, and this is actually what I've done for myself, is that I do watch the news still. I watch it for 10 minutes at the beginning of the day. That's all I really need. I need a 10-minute cycle, and then I'll do it 10 minutes in the evening, but not only 2 hours prior to when I go to bed, I do not want to be staying up because of what's going on in the news. So I allow myself those 10 minutes a day at different points in the day to really look at what the news. Then I can feel whatever I'm feeling, and then I can let it go. Which I wasn't allowing myself to do before. And I think we continue as people who want to be informed, who continue to want to stay ahead of whatever's going on, that it can actually be a hindrance. So that's what I'm recommending for anyone who's listening right now, is really to set up a schedule for the news that you're taking in.
Yeah, I love that. I think, I've heard some analogies, and that if we think of exposure like that, like similar to the sun, you don't want to overexpose yourself from these harsh energies. So find yourself some shade. You deserve that. And you won't be uninformed if you take a moment and find yourself some shade. Close the shutters. You don't want to keep the windows open and let the bad weather in when it's raining outside. You want to take a moment to look at it, acknowledge it, and then close it so that you can keep your house safe. And so those are just some ways to think about how we, like you said, determine what we can control and what we can't control. I love that. It's a great tip. Thank you, Tali. I think I'd love to hear just for our listeners, what is the best way to access you? They've heard from each of you as head leaders of these incredible nonprofits doing support for mental health and social service. If someone on our show today decides, I really need to contact Tali, Jessica, Mary, what do they do?
For family service, they would either call 210-299-2400 or go to our website at family-service.org. And both ways, they can access our information, talk to a person, find out what services we have, and then we can refer them to whichever of our many services they might need to access.
Great, thank you.
And I would go for us, it's jfssa-sa.org. That is the best way to get an immediate contact. Actually, somebody's monitoring that most hours of the day, and we all actually get a little ping, which is a lot for us, but so it's a big group of us right now doing that. But you're able to access that. It will also give you numbers for intake, anything else or questions. And we also have an Ask a Therapist, which is a column right now that JFS is doing where you can ask a mental health therapist any questions. You can write in anonymously and just, get an answer. And I think it's a wonderful resource. So
great. And we will be sure to put this information in the comments. Jessica?
So if you've got a child that's in immediate crisis, we are here 24/7. We have a crisis service department that can complete an assessment to determine a level of care and determine if immediate services are needed. That's located at 8535 Tom Slick. And again, you don't need to call. You can just come. Our website, we've got two actually that have a couple of good COVID-19 specific resources. Our prevention website is oneinfiveminds.org, and that's got a lot of great information on there, and it's got some parent-specific resources and teacher-specific resources. And then claritycgc.org would be our main website that would have information on how to reach out to us specifically.
Wonderful. Thank you. And if anyone is interested, if you are a youth, young adult, or family member who's struggling with a substance use issue, or you found that you've increased use and you're not sure whether or not you're developing a problem, don't hesitate to write us in at info@riserecovery.org or visit our website at www.riserecovery.org. So the major takeaways today have been profound. I learned a lot about the social determinants of health and how COVID has deeply impacted that, about the importance of taking space and grace for yourself and really breaking down what is within our sphere to manage and what needs to be let go as best we can so that we can get through the day-to-day marathon, as Jessica mentioned, which is not just for certain people. We all, as leaders, I can attest, me as a CEO, I have found myself weary from and having those lousy days and needing to acknowledge that and give myself a break in as much a way as my direct staff have been. And so We are all in the same storm, but our boats are different. And I hope that today's show has given you some ability to identify and to find some resource and some hope and courage, which is our intention with this show. So I thank each and every one of you. Mary Gar, Tally Dolge, Jessica Knutson, thank you so much for your time today, and I really appreciate you being on our show.
Thank you, Evita.
Thank you, Evita.
Thanks, Evita.
Thank you for our followers for submitting questions and watching live. Stay tuned for more events in the next month.